Hello, I understand you're here for your face exam. Okay, well, feel free to take a seat. So, have you ever had a face exam before? Okay, so a face exam covers each of the parts of your face, and I will be assessing how each of the parts of your face function. I will be assessing your scalp, your head, your nose, your eyes, your throat, your ears, your neck, and your thyroid. Okay, so none of the examinations today should be painful or uncomfortable at all, but if you happen to experience anything of any discomfort whatsoever, do let me know. Okay, so are you comfortable? Alright, so I'm going to begin by inspecting your skull as well as your face. So I could like if you could please just look at me. Okay, now turn slightly. Turn slightly again. I'm just looking at the symmetry of your face, looking from a distance for any deformities, irregularities. Okay. Alright. So now I am going to be pressing on your skull very gently, and I'm just going to feel for any irregularities. Okay. I'm going to gently palpate on your skull. I'm focusing more on your skull at first, instead of your scalp. We'll be looking at that in just a second. Okay, so I'm going to use one hand and I'm going to gently palpate. Let me know if you're experiencing any tenderness, soreness, anything unusual at all as I press around your skull, okay? Okay. Anything here? Okay. Anything here? Okay. Okay, let's have a look at the other side. Anything here? No, okay. I'm just going to bring my hand around the back of your skull, okay? Okay, now does this feel? Okay. Alright. Okay, I'm going to gently have a grasping motion of your head, okay? Okay. Okay. And all of that feels okay. Alright. Alright, so now I'm going to bring my fingers through your hair, okay? I'm also going to be examining the quality of your hair. Checking for any thinning or hair loss. Checking for flaking, dry patches, sores. Okay. How does it feel when I touch your hair? Does it feel okay? Alright, that's good, okay. Okay, so you have quite a fair bit of hair, so I'm just going to really focus on each part of your hair so I don't miss anything, so it doesn't feel tender or sore at all anywhere. Alright. Okay. And just having a look through your hair as well. Just looking for any redness or sores. Okay. Alright. Check behind your ear. Okay, let's have a look at this side. Okay, very good. Okay, so now I'm going to be moving on to assessing your facial sensations and motor functions. And I'll begin by testing your trigeminal nerve function. So I'm going to begin by placing my fingers on either side of your forehead and checking for symmetry, okay? Is it okay if I place my hands on your face? Okay. Position my fingers. Okay. I'm just going to move my fingers now in circular motions, checking for symmetry and also gently palpating at the front of your skull and face in general, just looking for any problematic issues, checking the symmetry. Okay, great. Now I'm going to be taking my index fingers and I'm going to be placing them at the top of both of your cheeks, okay? Okay. Position my fingers just so. Great. Feel tender at all? No? Okay. Okay, great. So now I'll be testing your facial nerve functions. So I'd like if you could please furrow your forehead. So just raise your forehead for me. Okay, and again. Okay, and can you close your eyes nice and tight? Okay, and again. Great. Can you show me your teeth? Give me a nice smile. Great. Okay, and can you now inflate your cheeks? And can you inflate your cheeks one more time? Okay, great. So now I'm going to be moving on to your ear exam. So I'm going to be having a look inside your ear as well as the exterior parts of your ear, okay? So I'm going to be using a light such as an otoscope to look down the canal of your ear. Is that okay? Okay. First off, though, I'm going to begin by just touching on your ear and assessing the exteriors of your ears. Is it okay if I begin with this one? Alright. So I am inspecting the external ear and looking for any skin abnormalities. Everything seems to look good. Okay. It's going to smell like a certain parts of your ear. Okay. Okay. Now I'm just going to move on to looking at your other ear, okay? So again, just looking for any abnormalities at all, any issues or concerns. Also looking for any differences between both ears. Obviously some differences are, of course, to be expected. Okay. Just gonna put a little bit of pressure, perhaps like the trachea, the cartilage, okay? Let me know how that feels. Feels okay, good. Okay, that's great. Okay, so now I will be assessing the health of your inner ear with the use of this otoscope. Okay? Alright, let's start with this ear. Okay, so the otoscope does not need to be used far down your ear at all, so this shouldn't feel uncomfortable. So now I'm going to be moving on to the whispered phrase test. I will simply be whispering certain phrases or numbers in each of your ears individually. Let me know what those phrases or numbers are. Okay. 1, 2, 4, 5. Great. Porcupine. Good. Light. Good. Switch. Good. Poke. Good. Flower. Good. Cardboard. Good. Brick wall. Good. Lint. Good. Wall paper. Good. Gloss. Good. Stick. Good. Sandal. Good. Purple. Good. 1, 1, 1. Good. 0. Good. Negative. Good. Positive. Good. Great. Now I'm going to be moving on to your next ear, okay? Okay, good job. Pink. Good. Carpet. Good. Blouse. Good. Wheel. Good. Track. Good. 1,000. Good. Light. Good. 2, 2, 2. Good. Camera. Good. Lab. Good. Circus. Good. Chair. Good. Door. Good. Kitchen. Good. Soda. Good. 7, 7, 2. Good. 10, 10, 20. Okay, excellent, great. Great job. And now for the last part of your ear exam, I will be doing what is called the finger rub test. So I'm going to be rubbing my fingertips together like this. And I'm going to be placing my fingers several centimeters away from each of your ears individually. And I would like if you could tell me when you hear when I rub my fingertips together, okay? So I'm going to sit here and I'm going to place my hands on either side of your ears, okay? Okay. Good. Good. Mm-hmm. Good. 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 Mm-hmm. Yep. Good. 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 Great. So that's the end of the ear exam portion of today's face exam. Now I'm going to be moving on to your eye exam. This will require me to be using a light to study your eyes, as well as gently touching around your eyes. Is that alright? Okay, so I'm going to begin with the physical assessment of your eyes, okay? Okay, so you can begin with keeping your eyes closed if you like. Okay. So I am checking for the symmetry of your eyelids and eyes. I'll be checking for any swelling or redness around your eyes. Okay. Okay, so now I'm going to be assessing your sclera as well as your conjunctiva. So I'm going to be very gently putting my fingers on your bottom eyelids, and I just would like if you could look up for me, okay? Okay. Okay, just look up. Okay, that's great. Okay. Just very, very, very gently palpating around your eye, okay? I'm having a look at the colours of your eyes as well as the vascular pattern. Okay, so if you could just look straight for me. Let's have a look at your pupil sizes now. They should be somewhere between the size of 3 to 5 millimeters. Okay, very good. So now I'm going to be moving on to using a light, and I'm going to be using this directly and indirectly around your eyes. So for the first part of the light exam, I'm going to be moving the light in and out of your field of view. I just need you to look at me for that part. And then I'm going to be moving the light as the direct part of the light exam across your field of view, okay? And this is just checking for your pupillary reflex towards light. Okay. So I'm going to begin with the indirect light, okay? Just need you to focus on me, okay? You don't need to look at the light at all. Just focus on my nose. Okay. Doing great. Okay, so now I would like if you again could just focus on my nose, and I'm going to move the light left to right, okay? Very good. Just moving it left and right. Very good. Very good. Okay, up and down. Okay, and if you could now follow the light with your eyes for me, please. Okay. Left, right, left, right, left, right, left, right, left, right, left, right, center, up, down, up, down, up, down, up, down, left, right, left, right, left, right, left, right, center, up, down, up, down, up, down, very good, up, down, up, down, up, down, left, right, left, right. Excellent. So now I would like to ask you to close your left eye for me as you study the Snellen chart. So you might have seen one of these before. You have, okay. So just keep that eye closed and let's study the Snellen chart together to the best of your ability. Okay. What do you think this first letter is? Okay. Keep your eye closed. What's the second row, do you think? FP. Okay. Now close your other eye. Okay. What's the third row, do you think? TOZ. That's great. Keep the same eye closed and the same one open. What's the next row where my finger is, do you think? LPED. That's great. Would you like to have a go at the next row? Okay. You would like to use the same eye? PECFD. Great. Now open your other eye and close the original one. Would you like to try it this row? EDFCZP. Great. And if you'd now like to open both of your eyes, let's have a look at this line. What do you think this is? FELOPZD. Yep, that's great. Let's try this one. Okay. So that is the Snellen part of your eye exam complete. So now I'd like if you could try to look down at your nose. Okay, now look at my nose. Okay, so now I would like for me if you could please follow my finger just as you did with the light. And feel free to follow my finger with both of your eyes, okay? Okay. Okay. Very good. like for me if you could please follow the tip of this pen with both of your eyes, okay? Same thing as the finger. Left, right, left, right, up, down, up, down. Okay, very good. Now I'm going to bring the pen towards your nose, and I'd like you to let me know when the object becomes blurry, okay? Okay, great. And again. Very good. Last time. Okay, great. So that is the eye exam portion of your exam today complete. And now we'll be moving on to your neck exam. So I'm going to begin by palpating at your neck in general. Is that alright? Okay. So I'm feeling your neck in general, feeling for any asymmetry, feeling at your lymph nodes, feeling for any tracheal deviation, and just gently palpating the area in general for any problems, okay? Now tell me, how does this all feel? Okay, good. I'm also palpating the parotid gland. Just feeling your lymph nodes in your neck. Everything seems to feel okay. How are you feeling? Okay. assessing the motion of your spine. So I'd like if you could please tilt your chin downwards into your chest. Okay, just keep that there for just a couple seconds. Okay, bring your head up, and if you could now flex your neck forward like this. Okay, great. Relax your neck. And now I'm going to be testing your spinal accessory nerve function. So I'd like if you could bring and turn your head this way. Okay, good. And if you could turn your head the other way. Okay, great. And now I would like if you could lift your shoulders, and I will be pressing down against your shoulders, and I would like for you to try and resist that action, okay? Okay, just going to press. Resist as best as you can. Okay, great. So now we'll be moving on to your thyroid exam. So I'm going to begin by palpating at your thyroid gland. The thyroid gland is not normally visible, so I'm just going to feel for the thyroid gland. Okay. Could you swallow for me, please? Very good. Just gentle palpations of the thyroid gland. Very good, okay. Okay, very good. That's your thyroid exam complete. So now I'm going to be using the otoscope again, and I'm going to be examining the inside of your nose, okay? But before we do that, I'm going to be assessing your general health of the exterior of your nose, okay? So I'm just going to be gently patting at your nose. Okay. How does that feel? Okay, good. So I'm going to close one of your nostrils, and I'm just going to be testing how you breathe through the other one, okay? Okay, I'm going to cover this nostril. Just normally breathe for me. Okay, I'm going to cover the other nostril. Okay, very good. I'm going to do that again. Very good. And one more time on the other side. Okay. Just going to touch down your septum. Okay, the cartilage at the front. Okay. So let's have a look inside your nose, okay? So I am having a look at your septum nasal mucosa as well as your turbinates. Okay. Okay. Everything seems to look pretty good. No causes for concern. That's good. Good. Okay, almost done. Thorough inspection of this nostril. Okay, thorough inspection of this nostril. Okay, very good. So I'm just going to be gently palpating the side of your nose for tenderness, just around the edge. Okay. So now I'm going to be inspecting your lips. So I'm just going to be gently palpating at your lips, okay? Okay. Good. Okay, great. So now, if it's alright with you, I'm going to be inspecting the inside of your mouth and I'm going to be focusing my assessment on your gums, okay? Okay. I'm going to pull your lip down slightly. Just have a quick look at your gums. Just checking for any redness or sores. Okay. So if it's right with you, I do need to use a light just to have a little bit more of a thorough examination at your gums at the back, okay? Okay. Let's pull that lip down slightly. Okay. And the other corner. Okay. Alright. Top of your mouth. Okay, great. And the other side. The front. And the bottom. Okay, very good. So now I'm going to be moving on to your throat exam. I'm going to be inspecting and assessing your tongue, your soft palate, as well as your tonsils and your posterior pharynx. Okay? So the majority of this is just going to require you to open your mouth for me if you could. Great. Right. Okay, and if you could place your tongue out for me. can you raise your tongue to the roof of your mouth? Okay. Okay, so I'm just going to use the otoscope again to have a look down your throat, okay? I won't need to put this into your mouth, I just need to put it at the front of your mouth just so I can see down there, okay? Okay. Okay, very good. Alright, very good. You can feel free now to relax. I'm now going to be finishing off your face exam today by assessing the skin of your face. Okay, so I'm just going to be gently palpating at your skin in general and making any notes of any lesions, moles, or any irregularities that I see, okay? Okay. So just a gentle overall skin assessment of your face. Okay. Okay, great. So that is your face exam complete. I see no causes for concern in any of the areas that I assessed and examined today. Okay, so do you have any questions for me? No? Okay. Well, you did brilliantly today, and thank you for coming in. Take care and have a lovely rest of your day. Goodbye.